prostate cancer, some hot topics, and just some different information that I haven't presented with Island Prostate Center before. So hopefully you find it relevant. Okay, so I forgot that Robert was going to be doing an introduction, so I had an introduction slide of me here. But yeah, so I'll talk about if there's any updates on nutrition recommendations for individuals with prostate cancer. I'll also talk about certain healthy eating strategies with prostate cancer, including a study from this year. And I'll also go over muscle mass, so why it's a concern with prostate cancer and what we can do about it. And then if there's any time, we can answer any, or I can answer any questions that you might have for other things you want to discuss. Okay, so as for updates on nutrition recommendations for prostate cancer, there isn't anything new at this time. I know a few of you from the past, but those that I don't, if you haven't attended a nutrition presentation through the Prostate Cancer Supportive Care Program, I would highly recommend that for all of the information related to diet with prostate cancer. There's also a presentation link as well if you want to watch a pre-recorded session. Yeah, so all the new information that continues to come out from all the studies over the past few years still have the same consensus guidelines, and the emphasis for nutrition recommendations with individuals with prostate cancer really just emphasizes reducing overall mortality, mainly from cardiovascular disease. So when I talk about healthy eating with prostate cancer, though, the main thing that we really want to focus on is including more plants in our diet, and that would be as many different types of plants as possible. So different vegetables, different fruits, different colors. I know with prostate cancer, there's a lot of research about, say, tomatoes and lycopene and cruciferous vegetables, but we still want to eat as many different ones as possible to get all of the different vitamins, minerals, and phytonutrients from all the different plants. And also with that, we'll get a heck of a lot of fiber that will make our gut bacteria happy. Yeah, and for plants, though, it's not just going to be fruits and vegetables. It's also going to be eating a variety of different legumes and grains as well. Those are going to be other things that we want to include. Yeah, and overall, I want people with prostate cancer to focus more so, well, not just with prostate cancer, sorry, but anyone really is to focus on their overall dietary pattern, not just looking at singular foods. So for example, not just eating one type of food, say like tomatoes or those cruciferous vegetables, thinking that that's going to make your health, or if you eat something that you might view as a sometimes food or something like that, as if it's going to break your health. We just want to look at our overall dietary pattern. And there's many different dietary patterns out there, all with different names, but they all share the same common principle, which is a minimally processed diet with including lots of plants that I just mentioned. So on the next couple slides, I will talk about more of a Mediterranean style diet pattern. So that would just be one type of dietary pattern. Yeah, and just like how I said, we don't want to focus on just one type of particular food. We also don't want to just focus on one particular macronutrient group. So whether that's carbohydrates or fats is going to be the thing that is going to make or break our diet. Yeah, we want to more so focus on the quality of those types of foods. So this study, which you can see the name on the bottom if you want to look it up yourself, was an intervention, randomized control trial where they compared Mediterranean style diet to just the usual care group in men with prostate cancer who were being treated with hormone therapy. and they really wanted to look at the impact of the diet on cancer-related fatigue and quality of life, which you can see mentioned in the title there. But they also looked at body composition and inflammation in those men as well. So this was a 12-week study, and I'll show on the next slide some more information related to that. But on this slide, I'll show you that at 8 weeks, when they compared the Mediterranean style diet to the usual care group, they did notice improved cancer-related fatigue, a significant reduction in total body mass, including reduced fat mass, and then also a significantly reduced IL-8 level, which is a marker of inflammation. So that was a good thing. So for this study, they defined a Mediterranean style diet pattern as less than 10% of energy or calories coming from saturated fat, 2.5 servings of fruit per day. And on the right-hand side of the slides, you can see what a serving size looks like for any of the foods there. So for fresh or frozen or canned fruit, that would be half a cup or half of a fist. Be mindful though, if you have bigger hands, that might not be accurate, but for me, it'd be half a fist, or just one whole medium-sized fruit, 5 servings of vegetables a day, 30 grams of fiber per day, 3 servings of fish per week, with a serving being the size of my palm of hand or size of a deck of cards, 1 serving of nuts and seeds per day, a reduction or total elimination of red and processed meats, and then 2 servings of dairy per day, and overall less than 2 units of alcohol per week. So usually a Mediterranean style diet would actually allow for more alcohol than that, mainly more red wine than that. But just in view of the prostate recommendations, they wanted to limit that even further. So they just did 2 servings of alcohol per week. So on this slide, it's very small, so I'll just kind of talk through it. But on the left-hand side, they show the different nutrients or macronutrients that they were looking at, or food servings. And then they compared the Mediterranean style diet to the usual control group. And then these were their servings that they had at baseline, and then at 8 weeks, and then at 12 weeks. And one thing I found quite surprising was that the fiber content in both of the groups was just shy of 35 grams per day, which is quite high. So even the men in the control group of the study were already eating lots of fiber. So it kind of impacts how we would view those results. We might possibly see an even greater comparison in a change in body composition, in energy levels and quality of life and inflammatory markers, if everyone at baseline wasn't already eating a fairly nutritious diet. The one thing at the top here, though, that's a bit different would be they looked at calories in a different unit, but yeah, basically at baseline, the Mediterranean style group was having 2,400 calories per day, and that was roughly the same for the control group. But then at 12 weeks, they were consuming 2,000 calories per day, and the control group was consuming the exact same amount. So it is possible too that it's the reduction in calories, or it could be the change in the other nutrients that they're consuming that cause the change in body composition, or a combination of all the above. But that's something that we need to look at when we look at the results. But what I was happy to see was that they noticed a significant change in the men who were asked to follow a more Mediterranean style diet, that overall they had a significant reduction in their consumption of saturated fats, a significant increase in how many omega-3 fats they were eating per day, a significant increase in the amount of fiber per day. So even more than the already good amount they were having at baseline. They did reduce their alcohol even further, and actually to the point of being lower than the recommendations. Yeah, and they significantly increased the amount of vegetables they had and significantly lowered the amount of processed meat and dairy that they consumed. And then overall, between the two groups, there was a significant difference between then how much fruits, veggies, fish, and basically all of these different foods that they consumed. So even though they both started at a fairly nutritious diet, they did end up with those dietary changes consuming even more of those beneficial nutrients. So it's likely that played a role in the inflammation in their body, how they ranked their fatigue levels, and then their body composition as well. So that was one of the newer studies from this year, which I found helpful, and it just kind of shows too, sometimes we look at nutrition studies or want to look at nutrition studies and recommendations for how it impacts our specific condition, say like prostate cancer, but I like that they looked at other factors which really matters for your day-to-day life. So how much fatigue are you experiencing and your quality of life. I like that. So along the lines of the Mediterranean style diet, just some other things that we would want to focus on with prostate cancer that they didn't necessarily talk about in that study are going to be focusing on it, eating more legumes, so chickpeas, beans, lentils, and soy products. That will be a wonderful source of protein, fiber, and all of those minerals that support our overall health. And soy products, including edamame beans, dried soybeans, tempeh, soy milk, tofu, all that, has been studied with prostate cancer. And like I said, if you aren't familiar with that information, then I would suggest you review that or attend the Prostate Cancer Supportive Care Program presentation for that. And another wonderful source of protein and fiber when we focus on more plants would be nuts and seeds. And while for prostate cancer, there actually isn't much evidence to show the impact of those nuts and seeds on prostate cancer progression or lowering the risk of recurrence of the disease, there is evidence to support that consuming 5 servings of that per week is going to lower overall all-cause mortality. So that kind of shows the impact that it plays on our overall health and heart health, and that might be through lowering inflammation like that other study showed. So just another reason we would want to consume that. And yeah, all of these plant-based sources of protein are going to be lower in saturated fat, higher in fiber, and contain other cancer-fighting compounds. So just one reason that we want to eat more of those. They can be mixed in with other fish, poultry, other meats if desired, but we just want to try to include more to get some of those other nutrients. Yeah, and particularly with prostate cancer too, we always focus on calcium for bone health with hormone therapy. So plant-based sources of this could be nuts, seeds, beans, fortified tofu, and other fortified nut milks. Or if you are consuming fish, then say canned salmon with bones would be a source of calcium as well. Yeah, and omega-3 fats, these we're going to want to have for the heart health perspective. Mainly the information for omega-3 fats with prostate cancer is a bit mixed on if it's going to have any benefit, like I said, on disease progression, but there's tons of evidence for it supporting our overall health. Yeah, so that could be through walnuts and ground flax seeds, chia seeds, hemp seeds, and an algae-based omega-3 fat supplement would be plant-based sources of that, or fish is a wonderful source of that too, which falls within that Mediterranean style diet pattern too. And then finally, the last thing that we want to think about, though, if we are consuming a more plant-based diet, is making sure that we are getting in enough vitamin B12 in our diet. And we can do that through fortified nutritional yeast or some other fortified nut milks as well. Or that's an easy one to take a supplement of as well. So it doesn't have to be 100% of the diet comes from plants. Like I said, we just want to focus on adding more plants into our diet. And if you want, then just please let Lana or Marcy know, and then I'm happy to share any recipes that you might enjoy, or I hope you would enjoy. So just with some of the recommendations that I had already said, and when I talk a bit more about tips for muscle mass building as well, this might be an exercise that you could do after the presentation, just to kind of do a bit of self-reflection. I find that self-assessment piece quite helpful for goal setting. So you could look at this, and like on this side, you could check off if you are already doing something, one of the recommendations, or if you want to do it, or if you don't want to do it, that's okay too. But yeah, and then just based on that, writing down your goals and making an action plan. And then another huge part would be following up and doing another self-assessment to see how things have been going. That's just something I wanted to say, because sometimes we always just talk about what to do, but not necessarily how to do it. And it's a bit harder for me to do on a presentation to walk you through that. But there are dietitian services available, which I'll talk about at the end of the presentation, which you could reach out to if you would like support in making these goals or implementing the goals. So the final thing I really wanted to talk about was how to build and maintain muscle mass. So why we care about this with prostate cancer, and how to implement the recommendations. So why we experience muscle mass loss with prostate cancer. Part of it just also happens with aging. We're going to experience changes in hormone levels, so that loss of testosterone. But that also happens with hormone therapy as well. And also with aging and with cancer and other chronic conditions, we get an increase in the inflammation in our body. So that will also impact our muscle mass and cause a reduction in it. So just while I'm on that point, just a reminder about the omega-3 fats that I was talking about. So it's not just heart health that they're beneficial for. They can be helpful for maintaining your muscle mass too. Also with aging and with certain cancer treatments, we can have changes in our energy levels, and all of that is going to impact the activities that we do and the levels at which we do them. And that will also impact our muscle mass. And then also with all of these factors, it's going to change our metabolism, but also our appetite. So that can cause changes in our muscle mass too. But I really want people to focus on maintaining their muscle mass with or without prostate cancer, just because it's so important for our physical function, what we can do every single day, and our independence. It plays an important role in our immune function, and it also helps regulate our metabolism as well. So yeah, that would be the importance of protein for those ones. So this paper here, it's not a study, but this paper down below, it talked about kind of the different factors that impact body composition when we have cancer, not just prostate cancer in particular. But on this picture, you can see that there's tons of factors that impact it. So inflammation, which I mentioned, endocrine would be our hormone levels, say the cancer therapy or other health concerns would also impact our nutrition needs, our metabolism, appetite, digestion, all that kind of thing. Tumor-derived factors can also cause inflammation in our body. So that's to say there's lots of things that are causing that, but there are still lots of things within your control to help minimize that loss and hopefully even grow some muscle mass too. And particularly muscle strength too, because muscle mass doesn't always correlate with the actual muscle strength. And in the same paper, they have this figure. So on the left, you can see that there are items that negatively impact muscle mass. And in the picture, you can see here with the less of the orange, that just shows less muscle mass on this individual. But then on the right-hand side, then these are some items that are being considered for the management of treating low muscle mass. So some have good evidence for it, and some there's mixed evidence, but they just need more studies to kind of know for sure. So one thing would be making sure that we're just consuming enough energy in general, ideally through nutritious forms of those calories. And then, yes, these are the recommendations for the amount of protein that we want to have based on our weight. And I'll give an example in the next slide about that. These are certain amino acids and their derivatives that build up or make up protein, and the amounts that we would want for those. And I'll talk about those in more detail on the next slide. They have this recommendation for the amount of EPA and DHA, which are omega-3 fats as well. That would be a bit more than the general recommendation for 2 servings of fish per week, but yeah, they're looking at that one. And then also certain vitamins and minerals. The main thing would be just making sure someone's consuming adequate amounts through a healthy, balanced diet. But if not, then we would maybe need a multivitamin. And if you wanted to speak with one of those dietitians that are available, they could help you know if that's something that you would need. But then vitamin D has been studied for muscle mass as well. And then it's not just diet though. We want to make sure that we're active. That's going to play a huge role. And yeah, there are the exercise services available through the Island Prostate Center too. So take full advantage of that for both your muscle mass, but also for your bone health too. Yeah, so here there are some other recommendations for maintaining muscle mass. Here you can see those are the recommendations for the amount of grams per kilogram of your body weight. So this is the general recommendation for when someone has cancer. So say I took an example of if someone weighed 187 pounds, and then that would equal 85 kilograms. So if I times that by 1.2 to 1.5, then it would be 102 to 128 grams of protein that they would want to have throughout the whole day. And a huge part with that is that we would try to actually like to spread out that protein throughout the day. Frequently when people tell me what they eat, they get a lot of protein with their dinner, but maybe just a little bit at lunch, and some people have almost none at breakfast. So that's actually something that we do want to spread out throughout the day, because there are some studies that show as we age that we need more grams of protein per meal to stimulate muscle synthesis. So the general recommendation for men as we age is 40 grams per meal. So if you times that by 3 meals, that'd be 120 grams. So that would fit within this recommended amount. 40 grams is quite difficult for many people, particularly while they're going through certain cancer treatments. So even if we spread that out and it's 25 grams with meals, but then we have 10 grams with snacks throughout the day, then that will be quite beneficial. I also put the point there that we would want to have protein after we're active. And there is a bit of debate on if that's actually needed for more recreational levels of physical activity. Say all the Olympians that we're seeing on the TV right now, they would definitely want to have it after their exercise sessions. But I still think it's a nice idea and a practical way of making sure that we are getting all the protein that we need throughout the day. Just having that quick dose after the meal or after the exercise to help rebuild the muscle that would have been broken down during exercise. One thing I do want to point out here is that certain, if someone has kidney function that's impaired, then the protein recommendations would be a bit different, and we actually don't want to overdo it. So anywhere between 1.0 to 1.3 grams per kilogram. But if this is someone like you, then I would suggest seeking out one-on-one recommendations from a dietitian. And then also with obesity, then the protein recommendations are 1.2 to 1.3 grams per kilogram of what's considered ideal body weight. Yeah, and then some other things though, to help maintain muscle mass, I'd already mentioned to exercise. Adequate hydration is actually quite important too. Make sure that we're going to have good blood flow and delivery of nutrients to our muscles. And the ones on the bottom here are a bit more specific. So branched chain amino acids are one of the types of amino acids that make up protein. And there's some research to show that higher consumptions of those type of amino acids in particular are going to be more beneficial for stimulating muscle growth. And the main branched chain amino acid that is being researched for that is leucine. Leucine, sometimes we'll see high-level athletes taking that through supplement form, but it is quite doable to consume that through foods. So meat and fish, for example, depending on the types, have anywhere between 1 to 2 grams per 100 grams of that meat or fish. And on this slide here, you can see that the recommendation is for 1 to 4 grams per day. Or that's what they're suggesting the recommendation should be. So if a serving of meat or fish gives 1 to 2 grams, then that could be quite doable. Cheese is a source. Legumes have about 0.5 grams per 100 grams. With the exception of peas, though, they have 1.5 grams per 100 grams, so that would be a good source. But we can also find leucine in whole grains and nuts and seeds. So basically any source of protein is going to have leucine in it, just the amounts are going to differ. Glutamine isn't listed on there, but that is another amino acid. They have it on this slide. And that would be another amino acid that would be in protein sources. So eggs, poultry, meat, dairy, actually even asparagus and broccoli are sources as well. And glutamine is actually made in our body from branched chain amino acids. So you'll be getting it through those other sources too. One thing here, frequently people just see it called HMB, but that's beta hydroxymethylbutyrate. And that's actually made from leucine, well, it's a metabolite of it. And it might activate muscle synthesis and limit muscle breakdown as well. So that's why I'd be recommended for maintaining muscle mass. But the thing is, though, that we can also get that through any leucine food sources as well. So we don't necessarily have to take a supplement for that. yeah, I wouldn't recommend really a supplement for any of these. I try to encourage through food sources as much as possible, just because then we get other nutrients that are beneficial for our health in those foods besides just the ones that are listed here. Carnitine is another one that is derived from amino acids, and it's made in our body, but we can also get it through certain protein sources, the main one being red meat. So that one's just a bit more debatable because it doesn't necessarily fall within the general prostate cancer nutrition recommendations. Creatine is the final one here, and it's going to be made by our body as well, and it's metabolized in our muscles when we're being physically active. So that's just another thing that we would want to consider depending on how active we are. But we usually consume 1 gram of it per day through our diet, mainly through meat and dairy, but once again, through other protein sources as well. And omega-3 fats, I already talked about the role of that in inflammation and our muscles, and named some plant sources and fish as well. And then vitamin D as well. You can get it through some fortified foods, but mainly that one would be a supplement. And once again, not just important for our muscles, but also for our bone health too, which is a huge one with hormone therapy. So those are the main recommendations for what to do to maintain our muscle mass as much as possible, and then maybe even promote the growth of it too. It's a bit harder, but it is doable. So those are the main topics that I wrote slides about and most of those recommendations are if someone is feeling well and is able to eat a variety of foods, isn't struggling with eating. But do know that if you are having any difficulties with eating or digestion as a result of your cancer or cancer treatment, you can go on the BC Cancer website and there's a bunch of different handouts. You just click the drop down based on the category of concern. And you can find some tips there. You can also click under specific types of cancer and click prostate cancer for some other information too. But if you are struggling with eating and digestion, then like I said, please reach out to a dietitian. And there are multiple available. Fortunately now, before it was a bit more limited, but through the Vancouver Prostate Center, you can speak with a dietitian one-on-one, and also speak or attend the nutrition presentation. Inspire Health also has lots of dietitians available, and HealthLink BC, you can call 811 and speak with their oncology dietitian. So all of these services could be available by telephone, and then Inspire Health and the Prostate Center also offer services by Skype or Zoom. And there's also other nutrition handouts on the Prostate Cancer Canada website. So that was it. I think I spoke quite quickly, so sorry about that. Yeah.